Dr. Frank Cunningham is Medical Director of the Pediatric Emergency Department at JFK Medical Center. Good to see you, Doctor.
Morning.
Well, it is morning when we're taping this program, so thank you for letting everyone know that. Doctor, let me ask you something. The whole idea of a pediatric ED, why that separate ED, which I actually have seen, it's terrific, as opposed to let the kid come into the emergency department? What's the difference?
Well, there is a big difference because the approach to pediatric emergency medicine is completely different than an adult approach. Kids come in all various shapes and sizes, and you need a system that will be able to tailor itself to meet those
Give us
needs.
an example.
Well, I mean, you have a small child who has a breathing problem and may need specific equipment to support that breathing. Let's say having to insert a tube into the child's windpipe. Well, the very small child will require a smaller tube than, let's say, an adult. So you need to have a system that's being able to respond to those needs that are unique to the child. Adults, it's basically an off-the-rack world. For children, it's a custom-made fit. And that's what the whole design for a pediatric emergency department is, to fit the needs of each individual child.
Yeah, I remember when I went on a tour with Ray Fredericks, the CEO, down at JFK, of the ED, the pediatric ED. What I was struck by is not just the clinical expertise, but the other thing that I was struck by was the look of the place. It looks and feels different because it's a pediatric ED. Is that a fair assessment?
It's a very fair assessment. The unique approach to JFK's ER was that it was centered around care of the child and the family that goes along with that child. It's a modern, state-of-the-art facility that is a 14-bed unit that will accommodate everything. And it's staffed by board-certified pediatric emergency physicians, as well as pediatric emergency physicians, staff that are trained, the nursing staff is trained in pediatric emergencies, as well as our technical staff that are equipped to deal with kids who are sick and injured and help comfort them.
What do you mean? It's interesting how you just said that staff is equipped to deal with children. What does it mean to be equipped to deal with children?
It's a mindset. It's a mindset because, you know, for a kid to be sick or injured, it's a very stressful time for not only the family but also the child. And I think it's comforting to know that if you're dealing with healthcare providers that are much more comfortable dealing with the child's illness and injury and are comfortable with it, and the parents will pick up on that. They won't get nervous because they see you're not getting nervous. That's one of the things I tell parents too, you know, is don't get worried. When you see I get worried,
yes,
then you should worry.
Good point. By the way, full disclosure, I should have mentioned this before. One of the reasons I know JFK is I've done some leadership and communication coaching at JFK over the last couple of years, and I've gotten to know some of the clinical staff as well. But it also, one of the things I found out about you in that process is that earlier on in your career, you got, I'm not saying this is what intrigued you about this, but you had an experience involving your own daughter.
Yes. That
caused you to see this whole world differently?
I did.
Describe it.
I did. Let me place the setting for you. I was in fellowship training, which is specialty training in pediatric emergency medicine at Montefiore Medical Center in the Bronx. And I used to commute every day from my house in New Jersey to the North Bronx. And one of these experiences came, had just finished a 12-hour shift at Montefiore. And about 1 o'clock in the morning, I'm driving down the street to go home. As I'm coming over the crest of the hill, I see a slew of flashing red lights. As I get closer, I realize these lights are all in front of my house. I pull up in a panic. Fortunately, my wife is a nurse, and my daughter, who was 6 weeks old at the time, has stopped breathing. My wife had performed CPR on her and revived her. But the thing that was important and very personal for me is that when we had a discussion with my wife, she told me that the emergency response was disheartening because she felt that they really did not know what to do.
They didn't know what to do.
They were, you have to understand, Steve, is that for a child emergency, especially a critically ill child, these are the very few and far between emergency calls that emergency providers respond to. And because they're so few and far between, the experience and comfort of dealing with them is very small. So when something like that does happen, it's very panicking and very chaotic. And this was the key thing that forged my decision to come back to New Jersey and to try to make a difference. And that's how I came back to New Jersey.
Dedicated to doing what?
To improving the care of pediatric emergency care for kids in the state of New Jersey. And
describe what you did, because before you got to JFK, you had an impact in other places.
I did. My first position was actually starting the Pediatric Emergency Department at Newark Beth Israel Medical Center.
Which is noted for its children's care.
Exactly. And I was there for 10 years and built that emergency department. Subsequent to that, I moved down to New Brunswick and started the Pediatric Emergency Department at St. Peter's University Hospital and was there for 8 years. And now I had the opportunity of starting a third Pediatric Emergency Department at JFK Medical Center, and they have given me full reign to be able to provide a premier community hospital pediatric emergency department.
What does it do for these children and these families, doctor, when you see them come in the worst possible situation with their children, our children, in the most vulnerable condition?
I think it provides a level of comfort for us to be able to deliver that care that they need, and knowing full well that that care may not be, it's not going to be the same everywhere else, and some places may be a lot less. I think it's important for especially parents nowadays, if they're going to be choosing a hospital to go bring their child to, is be aware of what exactly that hospital offers. Do they have a separate pediatric ER? If they do, who staffs it? How often is it open? Not all the pediatric emergency departments are actually open 24 hours a day, 7 days a week. So these are key things that you want to know and be able to bring your child to a hospital.
For a few seconds left, the most common pediatric problems children have that wind up having them be in the ED?
Most of it, there are going to be a lot of fevers, colds, cuts, bruises, broken bones, and various other gastroenteritis, for example.
First thing you have to do, so there's no confusion, call the ambulance? Call 911?
If you have any doubt, always call 911.
There should be no confusion about that. You have doubt, you call 911.
Call 911.
And you should know beforehand who's got, you can't be scrambling at that point, where am I going to go?
No. One of the things you should be aware of is trying to figure out is what resources are in your community. Which hospitals are in your community? What places that have what places have a specific pediatric ER? And where would your pediatrician want you to go?
Don't be trying to figure those things out in the last second.
The last thing you want to do is figure out in the last
Dr. Frank Cunningham, Medical Director of the Pediatric Emergency Department at JFK Medical Center. I want to thank you for everything you do every day for our children. Thank you, Steve.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of CAUCUS New Jersey has been provided by Investors Bank, Berkeley College, MagnaCare, Fedway Associates, NJ Best, the law firm of Gibbons PC, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. CAUCUS New Jersey has been produced in partnership with TriStar Studios.